My name is Mary Sayer. I am the Primary Care Program Director for Housecall Providers. I'm also an RN, and I was fortunate enough to be the first transition nurse for Housecall Providers a year ago when our practice was selected to be part of a national demonstration called Independence at Home.
We added this transition nurse. So whenever possible, especially on our IAH patients, the one in the demonstration, as long as we know that they're going to the hospital and it's not the middle of the night, she will actually go to the hospital. She will take all the appropriate paperwork in hand. So she will take a copy of their med list, their problem list, maybe their last encounter, any labs they've had recently. And she will physically make sure that she finds whoever the hospitalist is and hands them those papers and says, here, this is who this patient is. This is what you need to know. So that in itself not only saves money, but it saves a lot of trauma for the patient.
Because of the success that we had the first year with the Independence at Home demonstration, we really had backing from the leadership, the board, that this is really the right model that we needed to offer all of our patients in the practice. And working with the clinicians with this team, with this transition team, has been the goal and is the goal to really focus on best patient care.
One of the reasons why this is such a wonderful program for our Housecall providers is that we have so many medically fragile patients. And so the primary care providers become the patient advocates, and that's where we are able to come in and really help, is when they're in the hospital, is help facilitate that advocacy for these patients.
By being the liaison for the patient and their family when they're in the hospital and after they've been discharged to the home, we are able to fill that gap. We are able to help them navigate that system and find the resources that they need, and be there to answer any questions they have about the medications and reconcile all the medications for both the patient and the primary care providers.
The benefit that our patients are seeing and will continue to see is that not only do they have these amazing clinicians that get to know them in their own home and home environments, but if the patient has to go through the hospital and have that hospital experience, they also have a face that is in communication with the clinician, making sure that the information is passed and that all of their needs are met with the plan for discharge, so that when they come out of the hospital, that there's not that bounce back, going back into the hospital again.
It's such an important model. It saves a tremendous amount of healthcare dollars, keeping patients out of the hospital, just providing that care that everyone would really like at the end of life.